wake up feeling hollow, my bones like brittle glass. Life's heavy burdens follow, but I won't let them pass. The weak can find their fire in every aching step, climbing a little higher in the void where dreams are kept. I'm not a shadow anymore, I'm finding muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow. My hands are shaking steady, sweat drips like melting ice. I've never felt so heavy, but I don't need to think twice. Fear feeds on fragile whispers, but I'll scream till it's worn out. Every scar turns it into blisters, I keep fighting, shed the doubt. I'm not a shadow anymore, I'm fighting muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow.
Welcome to the Deep Dive. Today, we're going to be tackling deconditioning syndrome, but we're going deep, focusing on the advanced stages and how to provide the best care possible. You know, it's like reaching that expert level in a video game where the stakes are high and the challenges, they can be complex.
Yeah.
Our source material kind of reads like a training manual for healthcare professionals,
Yeah.
but don't worry, we're going to break down all those key insights you need.
Yeah. Think of this as your shortcut to understanding this complex medical situation.
Exactly. And to guide us, we have our expert here,
Without needing a medical degree, I'm happy to be here.
who can connect all the dots for us and help us see the bigger picture.
Yeah, unpack these ideas and explain why they matter.
Now, the source material kind of jumps right into palliative care,
Mm-hmm.
which I think can sometimes be associated with end-of-life care.
Right.
But I was surprised to learn that it's so much broader than that.
Mm-hmm.
Can you explain what palliative care really means in this context?
Yeah, you're right. Palliative care is often misunderstood. It's not just about the final stages of life. It's about maximizing quality of life for anyone with a serious illness at any stage. Think of it as a layer of support that focuses on comfort, symptom management, and addressing the needs of both the patient and their family.
So it's not just about medical interventions, but
Yeah.
like a more holistic approach to well-being.
Exactly. It's about understanding what matters most to the patient and working to achieve those goals, whether it's pain management, emotional support, or simply spending quality time with loved ones.
That's really insightful. It shifts the focus from just treating the disease to truly caring for the person. Now, the source material gets into some specific signs of what they call end-stage deconditioning. And honestly, some of them were pretty alarming things, like extreme difficulty with basic tasks,
Right.
like eating or bathing, severe muscle wasting, constant fatigue, and relying heavily on others for even the simplest things.
Yeah, it's definitely a stark picture, but it's important to be aware of these signs because early recognition is key. The earlier these issues are addressed, the better the chances of slowing down that progression and managing those symptoms effectively.
That makes a lot of sense. The source material even recommends using specific assessment tools, like the Frailty Index, to catch subtle signs of decline before they become more obvious.
That's a great example. The Frailty Index looks at a range of factors beyond just physical symptoms. It considers things like cognitive function, social support, and even mood painting, a much more comprehensive picture of an individual's overall well-being.
So it's not just about how weak someone's muscles are,
Right.
but how well they're functioning in all aspects of their life.
Precisely. And this is where those ethical considerations we briefly mentioned come into play. The source material highlights a case study where the family is pushing for aggressive treatment, even though the patient is clearly exhausted and in favor of comfort-focused care.
That's a tough situation. How do healthcare professionals navigate such complex dilemmas?
It's all about open communication and shared decision-making. The healthcare team needs to advocate for the patient's wishes while also respecting the family's concerns and educating them about the potential benefits and burdens of different treatment options. Sometimes it requires bringing in additional support, like a social worker or an ethics consultant, to help facilitate those difficult conversations.
It sounds like a delicate balancing act, weighing the patient's autonomy with the family's emotional needs and everyone's understanding of the medical realities.
Exactly. And that's why clear, compassionate communication is so vital in these situations.
Now let's shift gears a bit and talk about the unsung heroes in all of this, the caregivers. The source material dedicates an entire section to the challenges they face, and it's easy to see why.
Yeah.
Imagine you're caring for someone with advanced deconditioning. You're constantly on edge, worried about falls, helping with personal care, and trying to stay positive.
Right.
It's no wonder caregivers experience exhaustion and depression.
You've painted a very realistic picture of the caregiver's burden. They often sacrifice their own well-being to care for their loved one, and it's crucial that we acknowledge and address their needs too. The source material highlights the importance of caregiver training, counseling, and respite care as essential tools to prevent burnout and ensure the caregiver can continue providing quality care without completely depleting themselves. Absolutely. Caregiver support is not a luxury, it's a necessity, and the source material emphasizes that this support should be tailored to the individual caregiver's needs. It might involve providing hands-on training in specific caregiving tasks like safe transfer techniques or how to manage challenging behaviors, or it could mean connecting them with counseling services to help process that emotional toll of caregiving.
It's interesting because the source material even talks about something called caregiver empowerment, which I hadn't really considered before. What does that mean in this context?
It's a powerful concept that shifts the focus from viewing caregivers as simply task doers to recognizing them as active participants in the care planning process. It's about equipping them with the knowledge, skills, and confidence to advocate for their loved ones' needs and to make informed decisions alongside the healthcare team.
So it's not just about giving them instructions.
Right.
It's about giving them a voice and recognizing their expertise in the context of their loved one's care.
Precisely. It's about collaboration and shared decision-making.
That makes a lot of sense. I can see how that would not only benefit the patient, but also help the caregiver feel more supported and less isolated in their role. Now, I know we've been talking a lot about the serious aspects of advanced deconditioning, but I think it's important to remember that there can be moments of joy and connection, even in challenging times.
Yeah. Absolutely. The source material reminds us that even in the advanced stages, it's crucial to focus on fostering meaningful experiences for both the patient and their family. It might be something as simple as sharing a meal together, looking through old photos, or listening to music that evokes happy memories.
It's about finding those glimmers of light amidst the darkness and cherishing the time we have.
Exactly. Celebrating life even in the face of serious illness is so important.
Speaking of finding those glimmers of light, I want to highlight something that really struck me in the source material. The case studies. They brought the theory to life and showed how different approaches to care can play out in real-world situations.
Those case studies are so valuable because they illustrate the complexities involved and how healthcare professionals tailor care plans to each individual's unique needs and circumstances.
There was one case study in particular that stood out to me. It was about a gentleman with advanced deconditioning who had lost the ability to walk. The healthcare team, in collaboration with the patient and his family, focused on creating an environment where he could still enjoy his favorite hobbies, like listening to music and watching old movies. They even set up a system where he could video chat with his grandkids.
That's a beautiful example of how, even when physical abilities decline, quality of life can still be prioritized. It's about focusing on what brings joy and meaning to the individual, even in the midst of challenging circumstances.
It really shifted my perspective on what's possible, even in the later stages of this condition. Now, before we wrap up this deep dive, I want to touch on something that wasn't explicitly mentioned in the source material, but I think is a really important consideration for our listeners, especially those who might be feeling overwhelmed or unsure of where to turn for help.
I'm all ears. What's on your mind?
Well, we've been talking about the complexities of managing advanced deconditioning syndrome, and I can imagine that many of our listeners might be feeling like they're facing a mountain of challenges.
That's completely understandable. This is a lot to process, and it can be incredibly daunting to navigate these complexities alone.
Exactly. So here's my thought. If you or someone you love is facing these challenges, consider reaching out to a home health physical therapist.
That's an excellent suggestion. Home health physical therapists are often overlooked. But they can be such a valuable resource in these situations. Why a home health physical therapist specifically?
Because they bring expert guidance on how to navigate the physical aspects of deconditioning right into the comfort of the patient's own home. They can assess the patient's needs, develop a personalized care plan, and help implement strategies to improve mobility function and overall quality of life.
They can also play a crucial role in educating both the patient and the caregiver on safe and effective techniques. I'm thinking of things like proper transfer techniques to prevent falls, advice on using assistive devices, and tips on managing pain and discomfort.
Exactly. They're like an extra set of eyes and ears monitoring the patient's progress, making adjustments to the care plan as needed, and providing reassurance and support along the way.
And perhaps most importantly, they can help identify any potential risks or complications early on, which can be crucial in preventing further decline and ensuring the patient receives timely medical attention if needed.
Right, and let's not forget their role in connecting patients and families with other support services in the community.
Absolutely. Home health physical therapists are often well-versed in the local resources available, whether it's respite care to give caregivers a much-needed break, support groups to connect with others facing similar challenges, or counseling services to address the emotional impact of the situation.
So by reaching out to a home health physical therapist, you're not just getting expert physical care, you're tapping into a whole network of support.
It's about empowering patients and families to take an active role in their care and to advocate for their needs.
And it's about recognizing that even in the face of advanced deconditioning, there are steps we can take to promote comfort, dignity, and connection.
It's about making the most of each day and cherishing the moments we have, whether those moments are filled with laughter, quiet companionship, or simply a sense of peace.
Beautifully said. Now, before we move on to our final part, I want to pause and ask our listener what's resonating with you most from our conversation so far. What stands out to you as particularly helpful or thought-provoking? Take a moment to reflect on what we've discussed and how it might apply to your own situation or that of someone you care about. So we've covered a lot of ground today, from understanding the often misunderstood concept of palliative care to recognizing the signs of advanced deconditioning and the unique challenges that caregivers face.
Yeah, we've also delved into those ethical dilemmas that healthcare professionals have to navigate the importance of open communication and shared decision-making, and that power of caregiver empowerment.
And we highlighted the incredible value of reaching out to a home health physical therapist, not just for their expertise in physical care,
Right.
but for their ability to connect patients and families with that wider network of support.
It's been a deep dive indeed, exploring a very complex and sensitive topic with layers of considerations.
But I think it's important to end on a note of hope and empowerment, even in the face of advanced deconditioning.
Right.
There are ways to promote quality life, dignity, and meaningful connections. It's about focusing on what truly matters.
Absolutely. It's about shifting our perspective from what's been lost to what can still be cherished, finding joy in simple pleasures, celebrating small victories, and nurturing a sense of peace and comfort for both the patient and those who love them.
And it's about remembering that we don't have to navigate these challenges alone. There are resources available, experts who can guide us, and a community of support ready to embrace us.
Knowledge is power, and by understanding the complexities of advanced deconditioning syndrome, we can empower ourselves to make informed decisions, advocate for the best possible care, and create an environment of love and support for those facing this challenging journey.
So as we wrap up this deep dive, I want to leave you with one final thought that builds on our discussion about home health physical therapists.
Right.
We've talked about their expertise in assessing needs, developing care plans, and providing that hands-on support.
Right. They can be instrumental in helping patients maintain as much function and independence as possible.
But what if we view them as more than just care providers? What if we see them as guides,
Okay.
helping us navigate not only the physical aspects of deconditioning, but also the emotional and existential challenges that come with it?
That's an intriguing perspective. I like where you're going with this.
Think about it. They're trained to understand the progression of this condition and to anticipate the challenges that might arise. They can help us understand what to expect, how to prepare, and how to make those difficult decisions with clarity and compassion.
They can also provide a sense of perspective and grounding when emotions are running high, reminding us to focus on what truly matters and to celebrate those precious moments we have.
Whether the goal is to reverse deconditioning if possible, to slow its progression, or to transition to a comfortable and dignified end-of-life experience, a home health physical therapist can be an invaluable companion on that journey.
They can offer not just practical support, but also emotional guidance, helping us find strength, resilience, and even peace amidst all those uncertainties.
So as you reflect on what we've discussed today, I encourage you to consider reaching out to a home health physical therapist. It could be the first step in a journey of empowerment, connection, and compassionate care.
Thank you for joining us on this deep dive into expert-level care and end-of-life management. We hope you've gained valuable insights and a renewed sense of hope.
And remember, you're not alone. Reach out, seek guidance, and embrace the power of connection. Until next time, keep exploring, keep learning, and keep diving deep